Awesome. Well, good evening, everyone. My name is Jae Cobb. I want to thank you all for joining me this evening on this wonderful, wonderful discussion on the evolution of Black health and heritage in healthcare. I wanted to do this discussion this evening because it's something that's very personal to me, having experienced medical bias as well as having family members that have experienced medical bias. Um, I just wanted to really bring some light to this issue and kind of how it came into existence. I myself am a chronic illness patient. I have multiple conditions. I've essentially been a patient since I was about 6 or 7 years old. My journey in the chronic illness community started with chronic autoimmune urticaria and asthma and allergies. I can remember being a itty bitty, and my mother would race me to the emergency room because I would just randomly break out in hives the size of tomatoes. And she would push and push and push. And even though I was young, it was just very difficult for us to find answers and to get a certain level of treatment from certain doctors and hospitals. And I didn't quite understand it at that point in time. But as I got older, it really dawned on me that not every doctor was the same, not every hospital was the same, and that you really do have to have a voice in order to receive the best medical care. As I got older and I witnessed my own health change as well as my parents' health change, I noticed that you really did have to push to get better care being a minority patient, and that there were a lot of doctors who formed certain opinions based on the color of your skin and sometimes even your gender. And it's not fair. And this is actually something that is not brand new in our society. This is something that has been going on since the days of slavery. And that's actually where we're going to start our discussion this evening. Since the beginning of time, it seems like since slaves actually set their feet on American soil, they have been seen as African Americans. And when I say they, have been seen as inferior to many Caucasians, excuse me. And that is why they were used in medical experiments starting early as the early 1800s. Dr. J. Marion Sims, who is known as the father of modern gynecology, began to use African American female slaves in his medical experiments. And many would ask, well, why would he do that? The answer is very simple. In 1808, there was a ban on importing slaves from other countries. And many slave owners had to figure out, well, how can I increase my the number of slaves that I'm owning since I can't import them from other countries? Well, the answer was simple: have more slaves. Well, how do you have more slaves? Female slaves reproduce. So there became a huge interest in the amount of slaves that reproduce healthy babies. So healthy female slaves, of course, were worth more than unhealthy female slaves. So this prompted a lot of Caucasian doctors to perform medical experiments on female slaves in order to have them have healthy pregnancies. Now, some would say that this was helping slaves, but it really wasn't helping the slave. It was perpetuating modern medicine. It was actually capitalizing an economic upturn for the white man, in other terms. It also was convenient because they could perform these experiments on Black women and their babies without their consent because they were considered property and not human beings. Other things that we had learned during this time was that there were other professional benefits and other economic incentives. Gynecological, examinations of Black women influence the country's slave markets. As I said before, you have a healthy slave, you have a healthy baby. That means you have two healthy slaves that could go on to produce more slaves for your plantation. Slavery, medicine, and medical publishing ended up forming a partnership, and it established gynecology as a medical specialty. So we have slavery to thank for that. However, African Americans will not get the credit that they deserve for this innovation in modern medicine. Racist beliefs also spawned from the experiments done on African American slaves. Other things that came into existence during this time and other thought processes were that slaves had thicker skin than their white counterparts. They also had thicker skulls than their white Counterparts. They also got away with doing experimentation on African American women because they thought that we had a higher pain threshold than our white counterparts. The unfortunate side effect of all of this was that this carried on for generations and decades and was actually written into many medical textbooks that are actually still used today. In a survey that was taken in 2016, and if we think about that, that was only 5 years ago, about half of white medical students and residents had false beliefs about biological differences between white and Black patients. 25% of those medical residents agreed that Blacks have thicker skin than their white patients. Let that sink in. So something that started in the early 1800s, and we fast forwarded all the way to the 21st century, is still being instituted in many of our medical students today. That has been the foundation of medical bias and reasons why a lot of African Americans hesitate to get health care because they feel that either they're being experimented on or that they're going to receive less than adequate care by their providers, especially if that provider is a Caucasian provider. There's a lot of distrust in the community, and for good reason. After the end of slavery, we thought that maybe things would get better and things would go back to normal. Maybe we could build some trust. That was not the case. In 1909, 32 states within the United States made it legal to have mass sterilization. And this was performed in communities where there were poor, minorities, and immigrants. The purpose of all of this was for there to be control in these communities over population. The United States government felt that it was perfectly okay to control who had babies and when and how many. And these women, especially those that were incarcerated, thought they were going for regular checkups and exams or having appendectomies, but they were really having full-on hysterectomies without giving their consent once again. So we were having surgeries as slaves without our consent, having medical experiments done on us without our consent. Then we move forward to the 20th century and we're having more procedures done on us without our consent, thinking we're going in for one procedure and then a whole nother procedure is being done without our consent in order to have population control to control poverty in certain areas. Once again, this was totally legal in 32 states in the United States of America. Once again, thinking that we can overcome these things and that things will get better, it gets worse. From the time period of 1932 to 1972, the United States Public Health Service performed what we call the Tuskegee experiments in Tuskegee, Alabama. Now, what is this particular experiment? And I wish I was making some of this up. This is all true in our American history that often gets left out. We only hear the roses and the butterflies of American history. In this small community in Alabama, the United States Public Health Service came and they wanted to see what the long-term effects of syphilis were on the human body. And so they recruited hundreds of African American men and told them they were being treated for bad blood. Now, in the African American community, that was a term, that was the vernacular. That was a term that was used on a routine basis for many different things. So it was very easy to get participants to sign up for this particular experiment in the exchange if they were going to receive health care. They were infected with syphilis. If they hadn't already been infected, they were going to get infected. And then they were promised to receive treatment for their bad blood. Now, the thing that makes this particular experiment so daunting, or I can't think of a good enough word that makes it just awful. They enlisted prominent members of the African American community, a doctor and a nurse who were already serving the community, to help recruit other African Americans in the community. So you are violating the trust within the community, and to enlist these people for this experiment, knowing, and you are the physician and the nurse, knowing what you're doing, but you're willingly keeping this information from the community. And this went on for 40 some odd years. And the crazy thing about this experiment is that midway through, we had discovered penicillin, and that was a known treatment for syphilis. Some of the participants of the study were drafted into the military to go fight in the war during this time. And so upon their physical, it was discovered that they had syphilis and they were treated with penicillin. Some of those members came back and told the other participants of the study, and they wanted to get their shot. However, they could not get treated for the syphilis because their name was on a county-wide list that they could not be treated for the syphilis because they were enrolled in the Tuskegee experiments. And they watched, the community watched, the United States watched these men get sick over the years, and they knew they had a cure because they wanted to see what syphilis did in the latent stages. It was not until 1973 that a federal trial, a congressional trial, was held to talk about how unethical that this experiment was. And it wasn't until 1997 that President Bill Clinton issued an apology to the family members and those who survived this experiment. And so because of this experiment, there was a lot of mistrust in the African American community when it came to getting vaccines, when it came to getting routine medical care, because they didn't know, are you injecting me with something or are you actually helping me? So that put a really dark cloud for a very long time over our community when it came to accessing care. And a lot of our common, easily treated conditions like hypertension, diabetes, would go untreated because we couldn't trust the healthcare system. And that is just one of many instances where African Americans were betrayed. Another one that's lesser known and is actually one of my favorite, and I encourage you to read the book. It's called The Immortal Life of Henrietta Lacks. I'm here in Virginia, and I love this story because this woman, Henrietta Lacks, was born in Virginia. She got married, she moved to Baltimore. Unfortunately, after having her children, she had cervical cancer. She had to go to Johns Hopkins. She relocated to the Baltimore area. And at the time, that was the hospital that most African Americans could go to receive care. It was the public health hospital. And we'll talk about accessing care and public health in a minute. And so she received multiple treatments at this hospital. And then the time that she's receiving her treatment, cancer treatment is not that advanced yet. So we're not expecting leaps and bounds of chemo and radiation. It was very difficult on her body. However, during one of her surgeries, the doctor, Dr. Gee, who was performing her surgery, extracted her cells, but without her permission. And you're seeing a theme here with a lot of the experimentation and the care, that there's a lack of permission within our community. And he extracted her cells, and her cells were isolated. He finished the surgery, everything else. But her cells reproduced indefinitely under certain conditions. And this had never happened before. And so this created an open door, per se, to medical research. So they kept looking at her cells and they kept reproducing and kept reproducing. And they're like, this is magical. So her cells became the first immortalized human cell line that they had ever worked with. And this was huge in the medical world. So over the years, they kept reproducing her cells, using them in scientific research. And you may know them now as HeLa cells for anyone in the medical community. They've been used to produce vaccines. They've been used for cures for cancer. Research to find cures for cancer, for treatment for HIV and AIDS, so many different things. But the controversy in this is they never told her that they harvested her cells. They never told her family that they were continuing to harvest her cells. And meanwhile, they've harvested her cells millions of billions of times, made money off of her cells, and they never told her family until a lovely lady named Rebecca Sleuth decided to write this story about Henrietta Lacks and her wonderful story and her contribution of herself to science and medicine. That is where the controversy therein lies, that we continue to take and take and take from a community and not give them anything back in return. And so that is why there is this huge distrust within our community to access care, on top of the lack of resources within our communities and the lack of trust and the lack of resources, as I said, as well as medical bias on top of all of that. So we've got decades of compounded issues that we are dealing with. This particular presentation for me is very timely. This week, I was watching TV. There's a show that I watch frequently called The Good Doctor. Don't know if anybody watches, but if you don't, you should definitely tune in. It's very, very, it's very awesome. So there is a character. She's an African-American physician. Her story unfolds over the past couple of seasons, but this particular episode is timely because it talks about medical bias. There's a patient that comes in, an African-American woman, excuse me, and she's having some type of a medical crisis. She is loud, she's incoherent, she's all over the place, but she is the epitome of what I like to call a strong Black woman. She's got a beautiful afro, she's eccentric, she's awesome as far as I'm concerned. But as she's being wheeled into the emergency room, she mentions she works at a marijuana distillery, whatever it's called. And so for this African-American physician, it gives her doubt that she's taking her prescribed medication. And I'm going to talk about that in a minute. And her blood pressure is skyrocketing, her pulse is skyrocketing, she's getting more delusional, but she's telling the doctor, well, I take my blood pressure medicine, and the doctor is not believing her. She is making a snap judgment based on the fact that she looks very eccentric, she's loud, she's boisterous, and she works in a marijuana distillery. She does not believe this woman that she's taking the medicine prescribed to her because her blood pressure is out of control, and that she's also an overweight African-American woman. So they give her the treatment, it works, but then they find out she has some medical condition, she has to have surgery, but then it comes out that this doctor made a snap judgment based on her appearance. The woman does not want to have the procedure anymore, nor does she want this African-American doctor working on her, even though before she was very grateful to have this African-American surgeon doctor at her disposal and working on her because it made her feel more comfortable. Now, how many times have we gone somewhere and we feel comfortable because we see a person of color, but we still don't get the treatment that we deserve? Or how many times have we gone somewhere and we see a doctor of a different ethnicity and we don't get the treatment we deserve, or we have these biases in our heads of how we're going to be treated? It happens every day. I know I tend to feel more comfortable when I see a person of color, but sometimes it doesn't work out the way that I think it's going to work out. Sometimes I have a white doctor and they completely blow me off because they see an African-American woman, I'm slightly overweight, I'm young, and it happens all the time. That's something that we as a community need to work on to crush these medical biases in our community. I just wrote a paper an article that about heart disease in African Americans. Yes, we are the highest affected race of heart disease. And a lot of times we are misdiagnosed because sometimes our signs and symptoms show up differently. A lot of times the medical community doesn't know that, and they don't want to listen to our signs and our symptoms. They don't care to take our histories adequately. They don't care to understand our lifestyle. And a lot of that is because they have preconceived biases and notions, and they make a snap judgment based on how we look or how we talk or how we present ourselves when we come into a doctor's appointment. And that's exactly what happened in this particular episode of this TV show. And I hate to say it, but for a lot of us, this is every day. This is every time we go into a doctor's office. This is every time we go into an emergency room. I was having a really bad flare the other day, and someone told me, well, just go to the emergency room. It's not that easy, especially when you have as many chronic conditions as I do. To go into an emergency room, it's literally like you are flipping a coin. Am I going to get the care that I deserve today? Or am I going to be treated like crap because they see a young African American woman coming in and assume, oh, she's just here for drugs, or she doesn't know how to take care of herself, she let herself go, there's nothing we can do for her, instead of understanding she has significant chronic illnesses and something actually might be wrong. We need to run tests, we need to examine her to make sure XYZ is not out of control. It literally is a crapshoot as to what you're going to get. But unfortunately, a lot of doctors are taught this, and they believe that that is the standard way to care for a specific type of patient. So all of that to say that a lot of African Americans delay treatment because of medical bias, and a lot of conditions that are easily managed, such as heart disease, diabetes, even cancer, to catch it early. The early detection prevention goes untreated because we don't want to go to the doctor. Now, to back up, and I'm sorry if I'm all over the place, I'm kind of hopping around in my notes here. In the days kind of following post-slavery, in the Reconstruction period, because there weren't a lot of African American doctors or doctors that would see African Americans, have community healers. And what would happen would be, oh, sorry, I'm having some technical difficulties here. What would happen is there would be someone in the community who would use natural healing and things that they knew to help us get through these tough times with our conditions. So whether it was herbs, diet, things that we knew that worked from our ancestors, because that's all we had. And it took a long time to start seeing a lot of African American doctors in our communities graduating from medical schools and being more prominent. And even today, we don't see as many African American physicians, but studies have shown that African Americans are more likely to go to the doctor if someone looks like them. And if not, they will use more of the natural healing to help them get through their conditions or over their sicknesses, because that's what they trust. And why is that? Because history has shown us, why should we trust? We have been lied on, we have been tested on without our consent. So, kind of bringing everything back, I discussed that there are less resources in our minority communities, and this is true. Unfortunately, a lot of our minorities are in the lower socioeconomic brackets, and unfortunately, those communities don't have as many healthcare centers. They don't have as many grocery stores, which means they have a higher level of chronic illnesses such as heart disease and diabetes. Unfortunately, because of that, they also don't have sidewalks. And I know that's like, well, what does sidewalks have to do with chronic illness? I'll tell you why. They also are not exercising, which contributes to the higher rates of chronic illness. Therefore, they're also not able to get to their appointments because they probably don't have transportation. It's a lot of different things. So the doctors who are at these clinics may not understand that Mr. Jones can't get to all of his appointments because he may not have transportation. He may not have the money for the copays. He may not have the money for his prescriptions. He doesn't have the budget to eat the heart healthy diet that has been prescribed. So it makes you wonder, are these doctors thinking about these barriers and breaking things down to make it accessible for their patients in these communities? Most of them are not. They are focused on patients who are able-bodied and who are able to participate in programs and do things that will effectively contribute to their health. That's another thing that we've noticed. Presentation of symptoms. It has been shown that with certain conditions, minorities, especially African Americans, their symptoms present differently. And with that being said, I will go with African American women. Our presentation for heart disease and stroke is often not the same as our white counterparts. It may not be the chest pain, the sweating, all of that good stuff. Sometimes it's just severe fatigue. It's an upset stomach. It's a headache. And a lot of times we'll go to the doctor and say we have a certain set of symptoms, and we're brushed off and it's told you have anxiety. You're just depressed. You're overwhelmed. You're tired. And those doctors are not doing tests to figure out what is really going on. They're quick to either write a prescription for a pill or saying, you know what, you're fine. If you don't feel better, come back in 3 months. Well, 3 months sometimes is too late. And you've had a massive stroke, you've had a massive heart attack, and you died. I know that's like the worst case scenario, but it happens more than you think. A lot of women are not able to advocate for themselves and push their doctors or even tell their doctors what tests that they would like to have ran or what they feel is going on with them. And that's kind of the sad part about this entire situation, because they're not sure what's going on. And you would feel that it's a doctor's responsibility to say, hey, let's look at this, just to make sure this, and this is going on, or this and this is okay. Excuse me, I'm getting parched here. But in all actuality, doctors are just trying to move people in and out, and that's no good for the patient. And a lot of us women might spend tops 2 minutes in the room with the doctor, and then we leave feeling even more confused, even more blown off than we did when we first walked in the clinic door. That is no way to feel when you're going to seek help when you've been feeling run down, or they'll say, oh, it's just a flu. No, it's not. And you don't feel any better, and things progressively get worse. And then by the time you figure out what it is, it's too late. Once again, there's a medical bias in there, as well as your symptoms present differently. Let's expand a little bit more on medical bias. I know there is an implicit bias that African Americans are lazy and that we don't want to do better for ourselves. We don't want to address our health issues. We don't want to get better. We're absolutely fine feeling the way we are. We don't want to make changes. And that's absolutely not true. Yes, there's a pill that will cure certain things, or, you just do what you want to do. Is absolutely fine. But that, for a lot of people, that is not the case. There are some people who want to do better. They just don't have the resources. And if a doctor would realize that, instead of just saying, oh, you're Black, you're lazy, you don't want to do this, you don't want to do that, then it would be absolutely wonderful. And the healthcare system would work a lot better if they would overcome that and learn different things. Now, another bias that is seen in the healthcare community is that African Americans do not feel pain like their white counterparts do. And that is something that bothers me to the core. And this goes back to slavery, when the experiments were being done and they felt they could do them to African American women, and they weren't feeling any of these experiments being done to them on their pregnant bodies, and that everything was fine, and they enjoyed having it done. You enjoy having your vagina torn open and babies pulled from you. And I don't think anybody would enjoy that, whether you're white, Black, orange, or purple. And that is still something that is thought of to this day. I have witnessed with my own eyes how patients are treated in the emergency room based on race and gender. I have gone in severe pain, in tears, doubled over, can barely talk, and given no medicine or no examination for my condition, and have had friends that I've taken who maybe have milder pain, and they get a full workup, great bedside manner, and they're given something for their pain, and they're not of color. I know it seems crazy, but this is actually being taught in our medical schools still to this day. And I actually talked to a nurse practitioner about this one day when I went to the emergency room. She was African American, and she said, I don't think that's true. And I said, I pulled up an article and I showed it to her, and she was very much in disbelief. And this article was dated 2017, and she just could not believe what she was reading. And she said, well, in nursing school, they don't teach them that. So obviously, there's a disconnect between what physicians are being taught and what the nurses are being taught. But I told her there really is a lot of bias in the way that healthcare is delivered to our minority patients. And that broke her heart. Um, I myself have been in a situation where I was in excruciating pain, and a male doctor, and actually it was an African male doctor. He had just came from the continent of Africa, and he accused me of so many ungodly things and told me I was not in pain. I didn't have anything wrong with me. And it was just the worst emergency room visit ever that I've had in my life. And I was in crippling pain. I have endometriosis, is one of my conditions. And I was having a really bad endometriosis flare. And my friend took me to the emergency room, who happens to be white. And if it wasn't for her stepping into the room with a white nurse, the situation would not have been resolved peacefully. And I would not have gotten the treatment that I deserved. And that says a lot about our healthcare system and how African American women are treated. And I know I'm not the first one to be treated this way. It happens more than you think. Um, I know there's research out there that says that Black women are less likely to be given pain meds than their white counterparts. And it's not a matter of, being addicted to them or anything like that. It's treatment. And that's a whole nother conversation for a whole nother day. But this is our reality. This is what we see every day. This is what I experience. When I first started my chronic illness journey as an adult, it took me years to get my endometriosis diagnosis. It took me a very long time to get my lupus diagnosis after being blown off by 2 white doctors who told me nothing was wrong and it was all in my head. To get pain management, I was blown off by 4 pain management physicians who told me that I wasn't feeling pain and that I was too young to feel pain. I really wish I was making this up, but this is what I've heard. And even now, if I have to go to the emergency room because things are out of control and I get a nurse who I'm not familiar with or who's new, one of the first things that he or she will say, oh, you're too young to have all of that wrong with you, or oh, you're too young to be in pain. And it hurts at first when you first hear it, but after a while, it kind of rolls off like water. When I know the reality is, for example, to be diagnosed with autoimmune disease, most women are diagnosed between the ages of 18 and 40. So I fall right in there. I'm 34 years old. Endometriosis, most women actually struggle an entire lifetime to be diagnosed. I luckily was diagnosed in my mid-20s, so I was right on time with that. I tell people heart disease does not know an age. There are babies who are born with heart disease. So that bias makes it difficult for some of us patients. I've grown a thick skin because I've been dealing with this, like I said, my whole life. But that bias for some people, it makes it hard for them to fight their battle and advocate for themselves. And it makes it harder for them to seek treatment. And for those who say, well, the resources are out there, just, go to the doctor. Well, it's hard to go to the doctor when you've had doors closed in your face, you've had people talk about you, you can't get the help that you need. And that's kind of where I wanted to go with this presentation, to say, this is where we've been, this is where we are now, and then to say, here's where we need to go. There needs to be comprehensive education to our healthcare providers that signs and symptoms and presentation of conditions are changing. You can't judge a patient based on how they look when they walk in. Now, I have some days where I go to an appointment and I look great. Then I have some days where I go to an appointment and I look like trash, and you can tell something is wrong. You can't judge a patient on how they look when they come into an appointment. Make resources available for everybody. That's another thing that I see is lacking in our communities, that a lot of patients are not seeking care because the resources are not there. Lastly, we need to have different treatment options that are affordable to our patients. That's another reason why they're not accessing care. And there's a bias, going back to that everybody can afford to just get their medication, but that's not true. I was having a talk with a friend who told me that her medication with insurance was $2,000. $2,000. I don't know anyone that can just afford $2,000 for a month's worth of medication. So that's something else that we need to explore. I think we also need to heal the hurts of our past and not ignore them when we're treating our patients. We need to acknowledge that for some people, they haven't quite gotten over their mistrust with certain doctors or certain experiences with doctors, because for a lot of people, that is what keeps them from going and seeking the care that they need in their lives, because they feel like they're going to end up like a Henrietta Lacks, like you're going to take a piece of me without me knowing, or you're going to inject me with something that I didn't ask you for, or you're not going to effectively manage my condition and you're going to let me down. And I actually felt like that when I was on my quest for my diagnosis with endometriosis. I felt let down. I felt like I could not trust any doctor at any point in time because nobody was giving me answers. And I feel that, and I know there is a history of that within me and my culture. And so we need to look at that when we are working with the African American community. And I want to kind of tie all of this up with the COVID-19 vaccine, and why a lot of African Americans and Hispanics and other cultures are not wanting to get this vaccine. It stems from a past of, oh, we're here to help you and this is going to be great for you. But it turns out, no, we're actually killing you. We're actually doing experiments on you without your consent. Now, I know it's 2021 and you willfully sign a consent and you read all the black and white, but you have to take in consideration a lot of communities have people where you don't have a high reading level. There's a language barrier. People don't understand. I fully understand how a vaccine works and everything, but a lot of people don't. And so because of our past and our history, there's a lot of apprehension about getting this new vaccine for this new disease that just basically came out of nowhere. And people are apprehensive to get 2 doses of a vaccine that's going to make you feel worse before it makes you feel better. And it's not even 100% foolproof to keep you from getting sick. So I understand the concerns of the community. And if you are old enough to have remembered the Tuskegee experiments or know who Henrietta Lacks is, that's definitely understandable. However, I feel like it's my job as someone who's knowledgeable and other people in the community who are knowledgeable to break down, well, this is what this vaccine is. This is what this piece of paper is saying that you're signing. This is how it's going to benefit you. We're not injecting you with something foreign. We're not taking your blood. We're not doing anything that you don't consent to. And I think that's the important part with this COVID-19 vaccine. I think that's the important part with us increasing our numbers of African Americans and Hispanics and Native Americans and Asians who get the vaccine is that we need to break down these walls and these barriers and put their misconceptions and their fears to bed. I also think we need to apologize for the lack of care and resources that we did not provide to them at the height of COVID, and kind of do better in that aspect as well, because we know that COVID affected minority communities more. When we think about it, a lot of those who live in low SES socioeconomic status communities, they have those frontline jobs they couldn't take off. They had to be in the faces of those who might have COVID. And then if they get it, they're spreading it to their families. And there was no relief for that population. So we need to kind of address that and then say, okay, we're sorry for all of that. Here's resources for that. And on top of that, let me ease your fears about this vaccine. So it all kind of goes hand in hand. It's essential in building those relationships and putting things to bed that happened years ago. That is pretty much the basis of my speech, or my talk, I should say, for this evening. I didn't know if someone had some comments or questions that were going to be forwarded to me. I really just wanted to talk this evening about where we've come from and where we are now. We've come a mighty long way, but we still have a long way to go. And I hope that this presentation this evening has shed some light on some things and will help us grow and enrich our communities, and solve some issues that kind of have been swept under the rug. And so we can kind of take them under and clean them up and move forward, and rebuild what is broken. I thank you all for hanging with me this evening. I have some time left. I had budgeted an hour, but I see to have gone through my content a little quickly this evening. But I thank you all for joining me this evening. I believe my information has been plastered this evening, but I really, really thank you all. And I hope to interact with you in another way soon. Thank you so much.